So, what if your husband's or partner's low energy, stress, and even your intimacy disconnect wasn't just normal aging, but something deeply hormonal, deeply fixable, and deeply misunderstood? So, today's guest is here to flip the script on men's health and give us a science backed, hope filled look at what is really going on. Welcome to the Life Lounge podcast. This is your front row seat to everything happening inside Life Network. I'm your host, Karie Johnson, and each week we bring you the top voices, transformational brands, and insider updates you do not want to miss. This is where self-transformation meets community, because when we grow together, we go farther. So let's dive in. Today's guest is Dr. Judson Brandeis, and he is a board-certified urologist, best-selling author, and national thought leader in men's health, hormones, and aging, a Harvard-trained physician and pioneer in regenerative urology. He's the author of The 21st Century Man and leads cutting-edge research on sexual health, testosterone, optimization, and longevity for men. He's now one of our newest Life Network experts, and today he is here to help us understand what's really going on for the men in our lives and how we can support their healing too. Welcome to the Life Lounge podcast, Dr. Judson. Thank you for being here.
Oh, it's my pleasure to be here. Thank you so much, Karie, for having me.
Oh my goodness. Thank you for joining us today, and then just for being one of our newest experts. Like, I did a deep dive on all your content, and you have so much out there, and you put, so much out in the world to help people. So thank you for what you do in the world. And I just kind of want to go deep on what you do and like what brought you into, men's vitality, men's health, hormonal, regenerative space. Like what brought you into that space?
What I found was that men really needed help. The longevity of men in the United States is declining because of alcohol, suicide, and opioids. And men are half as likely to go to the doctor as women are. And so men really, really need help. And as a urologist, many of the patients that we see are men. We treat prostate cancer and kidney stones and testicular cancer, bladder cancer, a lot of the problems that affect men. And so it was very natural for me to really focus on men's health and physical optimization, sexual medicine. And about 6-7 years ago, I discovered low intensity shockwave therapy and PRP for the treatment of erectile dysfunction. So regenerative treatments for the treatment of erectile dysfunction for men who weren't able to have sexual intercourse anymore. And that sort of led me down the path to learning about hormones and learning about physical optimization. And so 7 years later, here I am.
Oh my gosh, that's incredible. And I love that it's like very missional for you. Like you have a direct purpose to help people. And I hear that all the time. Like I can't get my husband into the doctor. And it is, unfortunately, and this is the saddest thing that you hear it is more alcoholism, suicide, and just thank you for that mission that you are helping so many people. So I do want to demystify a couple myths about testosterone specifically. There's so much talk out there today, and just to kind of clarify from your point of view, what do you think every man, woman should know about testosterone?
Yeah, first of all, testosterone is low when you're 12 years old. And when you go through puberty, it peaks at, 18, 20 years old at around 900 or so. And then every year after that, it goes down about 1 to 3%.
Wow.
And so that's the natural trajectory of testosterone. And so it's normal to go lower, but that doesn't mean that you have to accept that it's going to be low. If you're in your 60s or 70s or 80s and your testosterone's 300, you're going to do much better physically and sexually and energy-wise by boosting your testosterone. On the flip side, there are a lot of younger men in their 20s that want to boost testosterone to super physiologic levels, meaning levels that are way above that normal, because they want to build muscle, they want to play football, they want to, they want their performance to be better.
Right.
But there's a lot of danger in that. You really have to understand what you're doing. And if you're getting your information from gym bros and you're getting your testosterone on the black market, which, a lot of people do,
Yikes.
You got to be really careful. You got to understand that you're going to lose your fertility. It may jeopardize your ability to have kids in the future. You may lose your hair. You may lose your ability to have a normal sex life in the future, especially with some of the bodybuilding steroid drugs. So you really have to be informed
Mm-hmm.
before you start those kind of medications. And, for men that are older whose testosterones are lower, when you go on those medications, it's not just a question of sticking testosterone in your arm or getting some pellets. There are other things that you need to do to prevent testicular atrophy, to prevent buildup of estrogen. And so you really have to be smart about testosterone replacement, or you can cause permanent damage to yourself.
That's incredible. I'm so glad you brought awareness to that, because I hear it all the time of people who are just getting it black market type of stuff, and the side effects and the damage that it can cause long term. And sometimes you think you're invincible, right? At that, especially maybe at a younger age, and they're like, "No, I'm fine. It doesn't matter." But goodness, I'm glad you brought awareness to that. I think we need to be shouting that from the rooftops for sure. What is your specific take on natural supports versus clinical interventions of TRT?
It was interesting. I was at I think it was the A4M meeting about 6 years ago, and Ben Greenfield was giving a lecture on testosterone. And
Yeah.
he's like, yeah, somebody should really create a testosterone supplement that has all the things that are shown to boost testosterone. And I remember
Right.
kind of scribbling notes on that. And,
Yeah.
the year later, I came up with my support testosterone supplement, which has DHEA, which is a testosterone precursor. It has DIM, which blocks the conversion of testosterone to estrogen. It has Tongkat Ali, which increases free testosterone. It's got ashwagandha, which has been shown to increase testosterone. And it's got zinc, magnesium, and boron, which are electrolytes, which have been shown, which have been shown to boost testosterone.
I mean, that all of those things, very natural things that everybody should probably take. I mean, a lot of those things for women too. Those are good things for too, but specifically for all of that to naturally boost it. So that's incredible. Is there specific signs that we should be on the lookout as a woman to see in our men, like of things that might be, if they do have low testosterone, they might see?
Yeah. So, libido declining is definitely important. Losing muscle, putting on fat, growing sort of man breasts, difficulty sleeping, irritability, grouchiness, low motivation, low drive. Those are all signs of low testosterone. And, the thing is, there's no reason to replace testosterone or boost testosterone if you don't have any of those signs or symptoms.
Right.
So if you go to the doctor and you get your labs drawn and your testosterone's 200, but you're doing fantastic,
Yeah.
there's no reason to give someone testosterone. And
Okay.
if you have all those signs and symptoms in the absence of other things, like, so we check thyroid, we check B12, we check vitamin D, we check hematocrit to make sure someone's not anemic. We check, all sorts of things. We make sure that someone doesn't have sleep apnea. So there are a lot of things that can look like low testosterone. But if you don't have any of those things and your testosterone's 400 or 450 or 500, if we boost your testosterone, you're going to do so much better.
So true.
And I've seen that time and time again. And even, I have a lot of patients that are first responders, that are police, fire, SWAT team. And those guys need high testosterone.
Yeah.
I mean, I had a patient like literally last week. Guy came in, he's on the SWAT team in San Francisco. His testosterone was around 400. And, he was really dragging. And I got his testosterone up around 1100, 1200. He was doing fantastic. And he came to see me just for like a regular checkup. And he's like, "Doc, you saved my life." And I said, "What do you mean?" He goes, "I got into an altercation. I called for backup, but backup was 5-10 minutes away.
Oh boy.
And I was in an altercation with this guy with a knife. And if my testosterone was still 400, he said, I'd be dead right now."
Oh, 100%. Oh my gosh, that's powerful. You saved his life. You literally saved his life. So then, yeah, I love how you brought up, because, certain stressors are good in our lives, and then cortisol as well, specifically for people like that. And if it is too low, then it's like you're not able to have that like fight or flight response back, which we actually do need. We don't want to just be like couch potatoes.
So, for me, you have to manage each patient individually. If you have a patient that really requires intense physical activity in their job, then you have to treat them differently than, someone who's, a computer programmer that sits behind their desk all day.
Exactly. Looking at them individually and looking at the labs to see, like you said, if the numbers look okay, but, other things could be completely off.
Yeah. Now, the sad thing is a lot of people in the regular medical establishment who control access to testosterone don't really think about testosterone the way that I do. They think, oh, if you're in the normal range, with the normal range is like 300 to 900,
Oh, geez.
that everything's okay. Like I see tons of patients from Kaiser, and Kaiser, you can't get testosterone unless your testosterone's under 300. So you could have a testosterone of 350 and just be dragging and begging for testosterone, and they're not going to give it to you.
Oh my gosh.
And so I understand why people go, black market. I understand why they get information from gym bros, but in the On Life Network and in my book, in my videos, I put tons of stuff out there on testosterone. There's no excuse for people not to be educated about testosterone and how to take it safely.
That's so good. Thank you for putting that education out there, because there is a lot of misconception around it. And that's why I wanted to debunk some of that and just bring awareness to this number first and foremost. And we'll be linking all of your information that you put out there. We're going to be uploading a lot of your videos and content into Life Network so people could become more aware for themselves, for their partners. And do you treat people worldwide? Is there only locally? How do you?
For testosterone, I prefer to just do it locally.
Okay.
I'll do second opinions worldwide. So, if someone calls up from New York or Idaho or Georgia or whatever, I can give them my opinion on what they should be. And there's a lot of mismanagement with testosterone, but in terms of prescribing testosterone, and it's important that you do a lot of follow-up on these patients, right?
Right.
So you can boost somebody's red blood cell count, their hematocrit, and make it too high. And if it get too high, you can get blood clots, and those blood clots can even kill you.
Yikes.
So,
that's not good.
For me to do that for someone in Georgia and not be able to follow them up fairly closely. The other thing is, in my office, we do body composition analysis. So I like to see, with my patients on testosterone, I like to see them every 3 to 6 months to look at their body composition.
Okay.
And we like to see that improve on testosterone. Also, I do a lot of folks on semaglutide, right? So folks on semaglutide will lose fat, but they'll also lose muscle. So it's fantastic. Yeah. You put them on semaglutide and you put them on testosterone. So then they're losing fat and they're building muscle, and their body composition changes dramatically.
Oh, that's incredible. Do they need to be, I guess, local to California, or could they come and see you in person in California from another state?
It's honestly, it's better if they come from California.
Yeah, I would imagine. To see you frequently, to make sure
there are only so many hours in the day for me. And
right. Do you have like a list of certain doctors that you refer people to if they're living in another state?
Yeah,
that practice like you?
Yeah, not really.
Yeah.
To be honest with you.
I would imagine.
There's a company I work with called BioT that I do testosterone pellets on, and many of the BioT providers are really good, solid practitioners.
Okay, good to know. But you do have so many resources out there so that people can become more aware and educate.
I have tons of you can get my book. You can go on my, very soon I'll have on Life Network a lot of my videos.
Yeah.
I have a clone, men's health clone that you can, so if you go to globalmenswellness.com, you can get onto my clone and ask my clone any questions about testosterone. I have everything that I've ever written and know about testosterone loaded up.
That's incredible. I mean, that's a huge gift. And we'll make sure that we link that below, because, not all the doctors and practitioners practice like you do. So it is really just becoming more aware and learning the myths and what to look out for too. So for a woman and a man.
The crazy thing, I have one of my patients is a primary care doc, and I have him on testosterone. And he was telling me he was at a primary care conference, and their testosterone quote expert was telling people, you shouldn't get testosterone too high in men. It should be around 500, 600. And my patient he said, I was just about to stand up and say, bullshit, you don't know what the hell you're talking about. I'm on testosterone. My testosterone was like 300-400, and now it's at 1200, and I feel so much better, and I don't have any side effects, and I'm doing great.
Wow.
So
good.
Even the medical establishment is not really on board. But I've treated so many men with testosterone and gotten their levels to the point where it really transforms their life.
Yeah, and optimized for them individually, like you said. Yeah. So then with the 21st Century Man book, I know that you have inputted that into a podcast, which will eventually get piped in a Life Network as well. Can you tell us a little bit about your book?
Yeah, it started as a COVID project, and I was going to write a book on sexual health and sexual medicine. But, so many things affect sexuality for men over the age of 50, right? So when you're 20s and 30s, it's different, right? But, once you're in your 50s, so many things in life have to go right. Physically, you have to be in good shape. Mentally, you have to be in good shape. If you're depressed, if you're anxious, you're not going to have sex. Your relationships have to be in good shape. And then, and then your sexual organs and your sexuality has to be in good place. And so, as I was writing the chapters and patients were coming in, like I would have a patient, his sleep was really messed up. I'm like, oh, sleep affects sexual function, or another patient that, other things, who was having orthopedic issues and spine issues, right? So if you have a bad spine, you're not going to be having good sex.
Right.
If your flexibility is terrible, you're not going to be having good sex. So then all of a sudden I got a chapter on yoga, right? So,
It's so cool.
it just kind of built. And in the end, I had 101 chapters.
Oh my gosh.
And so, there was, physical medicine, but then there's there's a whole section on relationships. There's a whole section on addictions, right? If you're addicted to cocaine or marijuana or alcohol, you're not going to have good sex. There's a whole section on aesthetics, right? If you're not comfortable with how you look, you're not going to have good sex. And so it just kind of snowballed into this massive book. That all is, and it's written by myself, but also I don't know how Ben wrote his book, because it's such a big book to be written by one person. Right. I had 60 of my colleagues write chapters. So the heart chapters about the heart are written by cardiologists. The chapters about the spine are written by chiropractors and spine surgeons. The chapters about cancer written by oncologists. And so because I don't have expertise in everything. But then,
well, of course,
I edited down to make the book really uniform. And then we took the book and we turned it into a podcast, because, people don't read as much these days and people are traveling. So, each chapter is maybe 15, 20 minutes, and you get the flavor of each chapter in the podcast episode.
And is this good for men and women to listen to?
There are definitely a lot of chapters that relate to women, and there's some fantastic chapters that for women that I've never seen at any men's outlet. So, for example, Russ Bartels, a friend of mine who's a gynecologist in Phoenix, wrote the chapter on what men need to know about menopause.
Yeah, that's
and
good.
So it goes over menopause in great detail and the aging vagina and things that you need to do for women as they age. And so, at a certain point in life, in your 50s or 60s, your spouse is going through menopause, and either you can just close your eyes to it, and you and your spouse are going to kind of go in different ways.
Yikes.
Or you can educate yourself about it and get involved in it and engaged in it. And I think it'll bring you and your spouse closer. And if your spouse goes on hormones, I get guys all the time that come in and say, my wife just started pellets and she's on testosterone and she's chasing me around the house.
I love it.
He's like, I've been waiting for this all my life, but my testosterone's so low that I don't know what to do about it.
Yeah. Oh
and
my
so,
gosh.
Postmenopausal women that are on proper hormone replacement, are a force to be reckoned with.
I love it. Oh my gosh, that's incredible.
Yeah. So in this book, there's an amazing chapter. There's another chapter on health insurance, right? Health insurance is so horrible and bewildering in this country.
Yeah.
And this chapter written by two of my assistants who were students of public health at UC Berkeley, and a friend of mine who's an executive at Blue Cross Blue Shield, wrote this amazing chapter on understanding health insurance. And then there's another chapter on how women can help their male partners. So like, what can you do as a woman to kind of nudge or push your husband? And then Susan Bratton wrote an amazing chapter on how to please a woman,
That's
sexually.
so great.
So yeah, there's a plethora of stuff for women too, but usually it's the women purchasing it for their male partners.
I would imagine, like you said, it's the woman who's like booking the appointments for their husband to go into like dentist or, doctor's appointment, those type of things. And the men are usually the ones who are like, no, I'm fine. They ignore any of the symptoms until the wife is like, hello.
Yeah, I mean, there's even a chapter on dentistry.
Yeah.
You know, do you want to kiss a guy who's got like horrible teeth and teeth falling out and tooth decay?
No.
No. So, you know, you better get your teeth in shape if you want to have sex when you're in your 50s.
Right. Yeah. I mean, I was reading something that, flossing helps prevent dementia. I'm like, just little things like that, Alzheimer's and dementia. I'm like, that's, I didn't know that link. I'm like, that's incredible. Just with gum disease and things like that. So, well, that's good. Okay. So that's really good to know. We'll make sure that we link that. It's on Spotify right now. We'll be inputting that into Life Network and for women and men to listen to pass on to their men to listen to, or purchasing the book as well. I do want to dive a little bit more into kind of regenerative protocols. We talked a little bit about peptides. Any other thoughts on any other peptides, red light, NAD, which actually help men feel alive?
You know, the only peptide I really use on a consistent basis is PT-141, which is called bremelanotide or Vyleesi. So it's FDA approved for women for low sexual desire, but it actually works great for men for boosting libido and also giving them spontaneous erections. And then semaglutide obviously is a peptide as well, and that's an amazing weight loss peptides. You know, the thing is, I had a patient fly in one time for a consultation, and he was really interested in peptides. And I looked at him and I said, dude, you got to lose 50 pounds first before you even mess with these peptides.
Right. So true.
Like you got to do the basics first. And then once you've done the basics, then it's okay. You know, you want to throw in some BP 157 or some alpha thymosin alpha 1, you know, all that kind of stuff. But you got to understand a lot of these peptides really haven't been vetted the way that big pharma has to vet their drugs, right? So there's never been a single human study on BPC 157.
Really?
It's all anecdotal.
Wow.
Right.
Crazy.
So all these people are taking it and they assume that it works.
Yeah.
And people badmouth pharmaceutical companies and all that kind of stuff. But at the end of the day, pharmaceutical companies there's such a high bar for them to get their drugs approved that you pretty much know when you get a drug approved that it's safe and it's going to work, or it's going to work the way that. And then there's aftermarket research that also happens.
Right.
So that, you know, like if you look at the COX-2 inhibitors like Celebrex and those kind of things, you know, they found out that it did some things to some people several years down the line. And so they had to pull some of those drugs off.
Yikes.
But, you know, peptides is kind of the wild, wild west.
True.
And a lot of these peptides, you don't know where you're getting them from. You don't know who's making them.
Yes, that's the scary thing.
You got to be really careful.
You do.
You know, alternative medicine is great until it's not great. I remember when I was at UCLA, we have the busiest liver transplant program in the country. And I remember this one patient was a young guy in total liver failure. He needed a liver transplant because he took a supplement, you know, and it was unregulated and had something in it that just destroyed his liver.
Oh, no.
So, you know, you really got to be careful.
Yeah. Third party testing for supplements for sure is pretty key. Okay, so then I want to hear I love the story with the first responders too. Any other stories that stick out? Because I know we talked about like with suicide and just depression and things like that men go through. I'm sure you have many of those stories where you've changed their lives.
Testosterone is a phenomenal antidepressant and anti-anxiety. You know, it's probably every couple months I'll get a patient off their SSRI antidepressant or anti-anxiety medication because I get their testosterone up.
Of course.
And it's, you know, even the psychiatrist and the mental health professionals don't really appreciate how good testosterone is for improving depression, improving mood.
Yeah. That's incredible.
Yeah, I get this one guy, he owns the big sheet metal company in San Francisco, and he comes in like every, 5 months he comes in for his pellets, and he's like, yeah, my wife and my employees are telling me to get my ass in here because I'm too grumpy.
They can tell. They're like, it's time to go.
They can totally tell.
Oh my gosh, that's so good. And that, yeah, I love that. That's incredible. I can definitely see that, how that would affect, depression and anxiety. Is there any negative side effects if, with testosterone replacement?
Yeah, well, first of all, it affects fertility. Second of all, some people will lose hair on their head. It can cause your prostate to grow, especially if you're older.
Mm-hmm.
It can cause acne or, increase oily skin. The first month you're on it, usually put on about 5 or 10 pounds of water weight so your body kind of gets used to that
True.
testosterone.
Okay.
If you don't take countermeasures, it'll shrink your testicles to the point where they don't work anymore. And it can build up estrogen.
Okay.
And it can increase your hematocrit, which if you're not smart about it, can result in blood clots that potentially even can kill you.
Right.
So, it's important that you do it under medical supervision.
1000%. So if somebody there was a question that came through on Life Network and was specifically asking about baldness in men, and it's not hereditary or anything like that. Is that kind of like a red flag for somebody that they need to make sure that they're...
Well, there's this thing called androgenic alopecia. Alopecia means baldness, and androgenic means related to testosterone. And so testosterone gets converted into dihydrotestosterone, and DHT is what actually causes hair loss. But if you don't have anyone in your family that has any male pattern baldness, and you have a full head of hair, then you probably don't have that gene that gives you androgenic alopecia. And so if you're on high levels of testosterone, you probably won't lose your hair, but especially it's your mother's father. If your mother's father, has male pattern baldness and you're going to go on testosterone, you better watch out. But, so I advise my patients, minoxidil is a great drug that will prevent hair loss. Finasteride or Propecia is also a good drug, but there are some more side effects from finasteride or including decreasing libido, including erectile dysfunction. So I don't
fertility.
quite recommend that.
Fertility as well.
Well, yeah, you don't want to have, you don't want to try to have babies while you're on that medication. And it's really, really super dangerous for women when they're pregnant. Because DHT is essential for fetal development, especially in the male. So,
okay. That's good to know.
Yeah. And then
all things to me were.
Yeah. And then, red light therapy works really well for hair growth, and PRP works well for hair growth. So there are a bunch of stuff that I advise my patients. And I have in my book, I have an amazing chapter written by Miguel Canales, who is one of the top hair replacement surgeons in the country.
Oh, wow.
And helped develop the ARTAS robot, which is a robot that does hair replacement. So
amazing.
It's a great chapter in the book.
Okay, that's good to know.
See, there again, if you're losing your hair, you may not, although I've pretty much lost all my hair. But, if you're a young guy and you don't have your hair, you may not be able to attract women to have sex. So that was just another reason to put that chapter in the book.
Yeah, 100%. Like you said, like the whole aesthetic part of it, that's a huge factor and in libido and connection with your partner. So if you're not feeling good, and it affects everything, and it's depression, like we talked about too. So, wow. Okay, so we had another question come through. What labs should I encourage my husband to ask for at his next checkup?
Yeah, I mean, so there's definitely some basic labs like what's called a CBC, which looks at your red blood cell count, your platelet count. There's what's called a comprehensive metabolic panel that looks at your electrolytes, looks at your kidney function, looks at your liver function. Definitely vitamin D, because we all work in, not all of us, but a lot of us work inside. And so our vitamin D is low. Surprisingly, I checked my vitamin D a couple months ago and it was 18. I was like, holy crap.
Gotta get outside.
Yeah, I gotta get more sunlight. And B12. So those are two things you can easily do something about. It's very important to check your cholesterol levels, the way that we all eat. And a lot of people are sedentary. It's important to eat better to get your cholesterol levels down, and good cholesterol and bad cholesterol. And then it's important to check your testosterone, but not just your total testosterone, your free testosterone, your sex hormone binding globulin, your estrogen levels. And so those are sort of the basic labs that I would recommend.
That's good.
A lot of people go to these functional medicine places and they check. I see they come in with like a binder of like
Right.
20 pages of labs, and they get their labs done every 3 months. Like, to me, that's just totally unnecessary. As a physician, I only ever check something if I'm going to do something with the results.
True.
If there's an actionable thing that I can do with the results, if it's just purely for academic interest or whatever,
hmm
then
It's not
it's
necessary.
not
Yeah.
necessary.
That's super helpful because there are many, many places, like you said, it's like a whole binder full. So that I love how you kind of distilled that down to the top ones to look for, because those are very actionable ones that people can take some steps towards
Yeah.
to help them. So, okay. So any other supplements or nutrients that really move the needle for men over 40? I know we talked about some
Yeah.
already.
So, my favorite supplement, the one that I created, is called Affirm, and it's a nitric
Yeah.
oxide boosting supplement. And when I
Okay.
was at UCLA, my professor, Lou Ignarro, won the Nobel Prize for discovering nitric oxide as the second messenger, at how it boosts circulation. And then he and another one of my professors, Jake Rafer, had a chance meeting in a freight elevator at UCLA Medical Center.
So
And
cool.
that led to the understanding of how Viagra works.
Yeah. Oh my gosh.
And so you get nitric oxide from two sources, really. You get it from the citrulline arginine pathway,
Okay.
and you get it from nitrates. That's why people are selling beets, because beets
Oh
have
yeah.
nitrates.
Right.
Nitrates get reduced to nitrites in the mouth by the salivary enzymes and bacteria. And then in the stomach, the stomach reduces nitrites into nitric oxide.
Hmm.
And a better way of getting the citrulline arginine pathways through citrulline, because it's better absorbed by your intestines. And then your kidney converts it to arginine, and arginine is a nitric oxide donor, and then it gets recycled back to citrulline. So, and in the body, you get about 50% from the citrulline arginine pathway, and you get about 50% from the nitric oxide pathway. And so Affirm has both citrulline and beets, ginseng, and mirapuama.
Wow.
And the really cool thing is, last year at the Sexual Medicine Society of North America meeting, I presented data on nighttime erections using a device called the FirmTech that measures nighttime erections. And we were able to show that we boosted nighttime erections about 35%,
Hmm.
which is pretty
That's
amazing.
huge. That is
Yeah,
really
and
big.
it's really the first time anyone's ever used objective data to show an improvement in erectile function using a nitric oxide booster, right? A lot of times you use questionnaires because erections are really difficult to measure, because you're not going to go into the bedroom with like sticking a needle into a guy's penis to
Yeah.
measure pressures, while he's trying to be amorous with his partner. So,
No.
it's like not a lot of people would sign up for that study.
That's right.
But using the FirmTech ring, we were actually able to measure nighttime erections. And
Okay.
healthy young
Smart.
guys should get 30 to 60 minutes of nighttime erections. And so we were able to show, using my nitric oxide booster, that we were able to significantly improve that. And then this year, I submitted the Confirm 2 study, which is combining Viagra and Affirm.
Okay.
And so a nitric oxide will generate a molecule called cyclic GMP. And cyclic GMP creates a cascade that opens up blood vessels.
Mm-hmm.
And what Viagra does is it blocks an enzyme called phosphodiesterase number 5, which lives only in the penis, but you have phosphodiesterase enzymes all throughout your body.
Okay.
And what they do is they break down cyclic GMP, right? Because you can't keep your blood vessels open all the time. They got to open, they got to close. And so there should be a synergy between a nitric oxide booster and a PDE5 inhibitor like Viagra and Cialis, but no one's ever looked at that using objective data. And so
Incredible.
we used the FirmTech ring to measure nighttime erections, and the abstract is under consideration for publication and presentation, so I can't give you the punchline, but
Yeah.
just suffice it to say that it's very promising the data.
Yeah, it
And
sounds like it.
I look forward in October to presenting it and then really publicizing it. Because the thing is, a lot of men can't take a full dose of a PD5 inhibitor like Viagra and Cialis because they get side effects.
Exactly.
Right? They get headaches, facial flushing, sinus congestion, reflux. And so if you can take a nitric oxide booster and boost the effectiveness of a PD5 inhibitor through synergy, you can take a lower dose of the PD5 inhibitor like Viagra and Cialis and still get the same effects.
Oh, that's amazing. Okay.
And so it's I'm really, really, really looking forward to being able to present that research. But here it is. Like, I'm the kind of guy, like, I don't just say stuff.
Yeah.
Like, I actually do the research to prove it and then present it at national meetings with academic urologists that review abstracts and the same thing with my P-Long study, right? So you get, as a guy, you'll get emails all the time of like, take this supplement or do this and you'll increase the size of your penis. And
I'm sure
I would see guys in my office, since I'm a surgeon and a sexual medicine expert, a urologist, and guys do all sorts of crazy things to increase the size of their penis and really with disastrous consequences.
Oh, geez.
And so as a medical researcher, I said, there's got to be another way. There's got to be a better way to do this. And not that I really care about the size of guys' penises, because I really don't. The purpose of the penis is to urinate and procreate. And if you can urinate and procreate, your penis is just fine.
Right.
But I don't want guys to do stupid things that end up coming to my office saying, can you fix this problem?
Yikes. Yep.
And so I created the P-Long protocol, which is using a traction device called the RestoreX device, which was developed by a friend of mine at the Mayo Clinic, using a penis pump from the Dr. Joel Kaplan folks, using my nitric oxide boosting supplement, and using PRP or the P shot in the penis once a month for 6 months. And what we were able to discover is that we could increase the length and girth of the penis by the length by about 1 inch and the girth by about 1/2 inch. And
that's
also improve function. And so I have a network of about 50 or 60 doctors. If you're out there and you're interested in having a longer, thicker, better penis, you can go to p-long.com and find a provider close to you that can provide that service for you.
Incredible. Yeah,
but
I love how
again,
the research.
Like, it's published in Andrology, which is a reviewed journal. It's been presented at the Sexual Medicine Society of North America meeting. It's been published. It's been presented at the International Society of Sexual Medicine. So, folks in my field that are academic, that are at the top institutions, get a chance to review my research and say, like, oh, this is okay, or like, you're full of shit. So,
well, good for you for doing all the hard work for that, because I'm sure that's not easy.
No, oh my God,
I can't imagine.
What to recruit the patients for that study was really interesting.
Oh, I'm sure it was.
Because you can't, like, I have a friend that runs Diablo Clinical Research, right? So, like, when they needed people for the COVID study, they go to those folks. Like, I was in the COVID vaccine study. I was the 8,000th patient in the country to get the COVID vaccine. But I couldn't go to her and say, listen, can you recruit me patients for penile enhancement study?
That's
so
much.
So I actually listed it at clinicaltrials.gov, which is the NIH website. And I actually got a fair number of patients from just listing it on that site. But I had one time I got the call from this guy from Ohio, and he's like, I want to be in the P-Long study. I'm like, great, but your area code is Ohio. He's like, yeah, but it's listed by NIH. Can't you like fly me to California? I'm like, dude,
no.
The NIH is there to cure cancer and heart disease. It's not there to grow penises.
You're like, I wish I could help you. Sorry, bud.
So, but because of the subject, we couldn't list it on Google. We couldn't list it on Facebook.
Yeah.
And so I was doing, I create content for Pornhub Wellness. So Pornhub actually has a fully clothed site that talks about sexual wellness and those kind of things. And so I have a friend that runs that. And so I had a bunch of content up there. And so I said, well, maybe I can advertise on Pornhub. And so then you got to go and choose like what search words people are going to be looking for your advertisement to pop up. So, I got some people to participate in the study from Pornhub, but that wasn't really working. So then we advertised on Grindr, and we advertised on swingers websites, and then so eventually we through ingenuity we got enough. So we ended up with, I think, 30 patients that completed the study.
Okay.
Which is enough to show statistical significance.
Yeah, 100%. Yeah, like you said, it wasn't easy to find those
people,
but
easy.
You did it. You did the hard work to get that launched.
You would think they'd be coming out of the woodwork everywhere, but
yeah. I'm sure people maybe are a little bit shy about that too.
Yeah.
Okay, so then when in October, make sure to keep us posted on the results of your study and everything, all your hard work for that, and we can make sure to link for everything, and that's exciting. So good job, very putting in all that hard work.
So Affirm is, and I've no one in the face of the planet has taken more Affirm than I have. So
okay,
and I just turned 58, and I'm still fully functional and super happy. And so we have Affirm, we have Support, which is our testosterone booster. We have Spunk, which is a supplement for prostate health.
Okay.
And then I have Prelong, which is a supplement for premature ejaculation.
Okay.
Which is, so selective serotonin reuptake inhibitors, which are antidepressants, delay ejaculation. And St. John's wort is a natural SSRI. And the hyperforin in St. John's wort is the active ingredient. And so we isolated hyperforin and combined it with citrulline. And so Prelong is for premature ejaculation.
Okay.
Yeah.
You're covering all bases. Incredible. And I love how you incorporate more of the natural proven ingredients as much as possible too. So
yeah, I mean, the nice thing is I'm definitely into supplements and into natural medicine and into, ways that I can get my patients off the medications. I get patients that come in and they're on antihypertensives, they're on diabetes medications. And, I look them in the eye and say, dude, if you lose 40 pounds, start exercising, start eating better, I can get you off 7 medications.
Totally. Sleeping better too, and all of it.
Oh yeah, absolutely. Yeah. And, I think one of my talents as a clinician is really to be able to get that message across to my patients in a way. And sometimes they need tough love, and sometimes they just need a gentle reminder. But
and hearing it from somebody like you, other than their wife telling them.
Yeah, exactly.
So that's
and then, and then I have the resources to back it up. I give them the book. I have ebooks. I have my clone now. So you can go to globalmenswellness.com and talk to my men's health clone, which is just astonishing. Like, the technology for this is just unbelievable. And I put it up with my book and information from all my colleagues. And so you can really ask my clone any question about men's health, men's physical health, sexual health, hormonal health, mental health, nutritional health, physical fitness, and you'll get really, really an intelligent answer.
Without having to do a Google search of those keywords that might cause other things to pop
and
up.
The amazing thing is because I beta test all these things on my patients. I get patients coming in every day, and I'll put them on my clone and have them ask my clone questions. And first of all, it's amazing. Like, as my clone is talking, I'll be thinking of the answers in my own head, and it really echoes almost exactly what I would tell the patient. But then I had a patient come in, and I tell people, ask it the most difficult question you can ask. And he's like, all right, I'm on Ozempic and I want to take BPC 157, is that safe? And I don't think anyone's ever asked that question before, like, in the world.
Yeah.
Who knows?
Probably, who knows?
And my clone said, no one's ever written a paper on that, but this is the way that Ozempic works. This is the way that BPC 157 works. There shouldn't be an interaction, but, make sure that if you're doing that, you're going to be followed by a doctor to make sure that nothing bad happens. And I was
yes.
Wow.
That's incredible.
That was pretty
Brilliant.
amazing. Yeah. So,
Oh my gosh.
so, go to globalmenswellness.com and talk to my clone if you have any really, really complicated, difficult questions.
That's really good. I mean, you're a teacher, educator at heart as well, on top of, all the other work that you do, and you're constantly putting all of this hard work out there with your books, your
Yeah. And,
clone.
I think the value that I bring to the Life Network is that I have, almost an encyclopedic knowledge of urology. And I'm going to be putting a whole slew of videos on all different subjects in urology that, are the distillation of urology guidelines.
Okay.
So really the highest level of evidence in medicine we use to create guidelines. So if you have kidney stones, if you have prostate issues, if you have urinary tract infections, if you have bladder cancer, prostate cancer, kidney cancer, any urology issue, and you want to get, a 7 or 8 minute synopsis of what's the highest level of information, you can pop onto my sub channel on the Life Network and
So
get that
good.
information.
That's amazing. Thank you for doing all of that hard work, because we talked about before, there's a lot of myths out there, things that people should not be taking or doing, and the education, the awareness is key for this. So thank you. Okay, so I want to wrap it up with a few rapid fire questions. So what is one wellness habit that you specifically swear by?
Oh, exercise. I've been exercising but the thing is, as you get older, like I'm 58, right? I can't exercise the way that my 19-year-old son does.
Mm-hmm.
So I created what's called ABC.
Okay.
ABC is ambulate, bike, and circuit train.
That's
and
good.
you can substitute if you're a swimmer, or if you're a rower or whatever. But the thing is, once you hit 50, it takes 2 full days for your muscles to recover from any physical exertion, right? So if I go for a run, or if I'm on my elliptical, I usually do kind of a combination of elliptical and treadmill, right? I'm not going to run again for at least 2 days.
Okay.
Because if I do, I'll get hurt. So the next day, I'll get on my spinner bike and, put an hour in or whatever. And then the next day, I'm not doing anything for my legs, but I'll do circuit training.
Amazing.
So I'll do upper body, and I do yoga and those kind of stuff, and flexibility and balance. And then on the 4th day, I'll go back to running.
Okay. So you just kind of keep cycling through that ABC method.
And so, doing that, you don't get hurt. Because the thing is, when you're in your 20s or 30s, you can do whatever the hell you want.
Right. Exactly.
Right? And you're going to be just fine.
Oh, yeah.
But once you hit 50, you really have to be intelligent about how you exercise, or you're going to get hurt. And when you get hurt, it takes longer to recover. And then while you're recovering, you're going to get sad, and you're going to start eating more foods, and then you're going to put weight on. And then by the time you come back, it's going to be even harder. So, you really, really, really have to take good care of yourself.
You do, until it gets to be really bad. And like you said, like 50 pounds overweight, and then dealing with all the other things.
For me, exercise is a cornerstone of that.
I love that.
For mental health,
yes,
super, super important for my personal mental health.
1000%. I think for me too. So is in your book a chapter about exercise as well?
Oh, there's a whole bunch of chapters on exercise. Yeah.
Cool. Also on your ABC method that you do?
I don't know that I wrote that into the book, but I have ebooks that I give to my patients.
Okay, cool. Because I love that. I think that's a great protocol. So good. Okay. What is one thing that you wish more men knew about their health?
Oh, I wish they would go to my clone.
Yeah.
At globalmenswellness.com and ask my clone questions. Like, this technology is like, there's never been a person that knows more about men's health than my clone.
That's so cool.
It's astonishing. Like the AI technology is just astonishing.
It's so cool.
And I put in there my book, everything that I've written, all the really important papers that I've written and collected over time, and it's astonishing what my clone knows.
So cool. Okay, we'll make sure we link that one. And then, what is a belief or a habit that you have outgrown personally, and something that you might be replacing it with?
I pretty much stopped drinking alcohol.
Okay. Yeah.
There's really nothing good that comes out of alcohol. It's so integrated into our society. The alcohol companies convince you that you have to drink alcohol to be socially acceptable. But, first of all, it's a depressant. That's the class of drug that it's in.
Right.
It disinhibits you. So most of the stupid things most of us have done in life have been done under the influence of alcohol.
Good
and
point.
Everyone I say to shakes their head, right? And it's empty calories.
Yeah.
So if you drink a glass of wine, of red wine a day, for 365 days, that's 13 pounds of fat.
Yikes.
If you add up all the calories.
That's a good point.
And so I have patients that I can't lose weight. I'm like, well, you could easily lose 26 pounds of fat a year by cutting out 2 glasses of red wine a day. I mean, it's very simple math. It's 125 calories times 365 divided by 3,500. 3,500 is the number of calories in a pound of fat.
Yeah, so they could easily just drop it like that.
If you don't believe me, do the math yourself. But that's I understand why people drink.
Right. So what do you replace it with then? Because it is easier said than done for a lot of people.
I do juicing and I create smoothies and that kind of stuff. Stuff that's a little healthier.
Yeah, because you do have to have something to replace it with that you can look forward to. So, or whether that's like a walk outside or a hike, or
I'm kind of a sugar addict, so I'll replace it with something with my metabolism. Sugar is really strangely off the charts.
That's
my
good.
hemoglobin A1C is in the low 4s.
Wow, that's really good.
So I think I metabolize sugar a lot faster, which is why I crave it.
Your body wants it, obviously. Yeah. That's cool. I wish I had that. That sounds good. Okay, so is there anything, Dr. Judson, that we missed that we want to make sure that we leave our listeners with?
Oh, usually on podcasts, I ask if, I can give you advice to be healthier than 95% of men in 10 seconds. So if you don't drink alcohol, you don't smoke, you don't eat too much food, you exercise every day, you stretch every day, you do yoga every day, you do some mindfulness training every day, you don't do drugs, and you're nice to other people, you'll be healthier than about 95% of men.
So good. And be nice to other people. I like that in there.
Yeah, I mean, if you look at the Harvard study of health, the most important thing for health is actually relationships.
Yeah, community, connection.
That's why I threw and that's why I'm happy to be part of the life community.
Yes, that's right. That's right. Yeah, collaboration is the new currency, right? So we're continually to grow and evolve together, and just connecting all of our members with you and what you put out there, and just the awareness and education that you do. So thank you. You're incredible. So I know we've said it before, but just remind us again, where can people follow you, connect with you, all of those things?
Sure. So, if you're in California, or if you want to fly in to see me as a patient, just go to brandeismd.com, brandeismd.com. If you're interested in my supplement line, go to affirmscience.com, AFFIRM science.com. If you're interested in having a better penis, go to p-long.com. If you're interested in my book, The 21st Century Man, just go to the 21st Century Man, all written out in letters.com. And if you're interested in my clone, which, oh my God, I can't believe this technology. It's just it's mind-boggling. Go to globalmenswellness.com. And then I have a YouTube site, so you can look up my name on YouTube. I have a Instagram that I don't really use that much.
Yeah.
And God, I think that's enough.
That's incredible. We'll make sure to link all of that below.
That's enough.
You have a lot out there and constantly doing more. So, oh my goodness. So thank you so much for just fully showing up today, all your just education and awareness for all of our listeners, for the men and women. So it's super, super important. So we will make sure that we connect everything down below in the show notes. And for anybody tuning in, please don't forget to share this with a friend, partner, loved one who needs to hear this. And that is how we grow together. So for everybody, we will see you next time on the Life Lounge. Thank you, Dr. Judson.
Awesome. You're welcome.